Call the meeting to order. Can I get a motion for the adoption of the agenda?
Make a motion that we adopt the agenda.
Is there a second?
Second.
It's been moved and seconded that we adopt the agenda. All in favor?
Aye.
Aye.
Okay, moving on to consent items.
Aye.
We have the regular minutes for the November 18th meeting. Board members, if you haven't already done so, please review the minutes, and then we'll entertain a motion to approve.
So move.
Second.
It's been moved and seconded that we approve the minutes from the November 18th meeting. All in favor say aye.
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 Okay, motion carried. Any of the board members wish to make any opening comments at this time?
No.
Okay, if not, then we will move on to the regular business, starting with the management reports. Renee?
Good morning. I'm Renee Andrews with the Cumberland County Department of Social Services. I'm the Human Services Planner Evaluator here, and I'll be presenting the Performance Management Report with November's data. We're behind because of the timing of the meetings and making sure people receive materials. So all the information I go over today will be representing November's month of service. Look on the very first page with the budget information, you will see under foster care and adoptions that we are at 29%. And then for subsidized child care, you'll note that we're at 45% in the month of November. At the bottom of the page, we have the human resources data for the agency-wide turnover rate. Currently is, in November was 1.4%, and that was unchanged from October. The vacancy rate is 16.9%, which is an increase of 0.28% from October, so not even a quarter of a percentage point. And then if anybody has any questions, I'll be glad to take those. If not, we will go on to the adult services page. And with adult services, there were few fluctuations except for work first intensive services. And that kind of went down, and we're not really sure of the reason for that. So we'll keep on that and keep you posted if we can figure out the trends on that. For the rest of the adult services charts, everything is what we're seeing. Either we've had increases that are holding steady, or we're seeing fluctuations that are kind of becoming a pattern now. And with COVID, we're expecting these patterns to remain the same as long as we're in this type of situation, this type of environment. Do you have any questions about adult services? If not, we'll move on to economic services. You'll note with economic services that the FNS apps and cases, as well as the Medicaid cases, continue to trend higher than they did last year. With the pre-COVID numbers, things were running along normally, and then COVID hit and things have increased, and we're seeing that they're based on what we compare when we compare them to last year's numbers. If you'll look down at the bottom, the very last chart, I am so happy to say that we have finally gotten some numbers for a number of children served with subsidized child care. They reported out that we served 3,278 in the month of October that was paid in November. That number looks like is stayed pretty steady from September and October. Prior to that, there was a gap from April to August due to payment being made based on a combination of past performance and attendance, because during that time, some daycares were shut down or operating minimally, and the state put some safeguards in place to ensure that providers got paid as much as they possibly could during that time, or as consistently during that time, I should say, so that people didn't have to close their doors. But they've gone back to normal payment processes now. So we should be able to continue to see the number of children served on a continuous basis from now on. Any questions about economic services? All right, let's move along to children's services. You'll note that the total number of minor children in care, and that's from 0 to 17 years old, we have 802 in November. Youth that were 18 to 21, we had 56, for a total of 858 children that were receiving services in the month of November. We've seen decreases in most categories, but the ICPC or interstate compact, I forget what it's called. I forget the whole name, but it's the children that are in the custody of another state that we're providing services for and checking on. That has remained consistent, remained the same. Foster children placed out of state has increased a little, but that has to do with just where the available placements are for these children, I think. Let's see, delinquency numbers are down from last year. Our average last year was 24. Now we're at 18 for delinquency. Children, again, placed out of state, we've got 48. And then children placed out of county, we have 291. Any questions for children's services data? Okay, if not, this completes my report. Thank you.
Thank you, Renee. Moving on to services reports, we'll start with business operations. John? John?
So I think I'm kicking it off for him, Bill, and then John.
Oh, okay. Okay.
That's okay. It's fine. So board members, you should have, and I think, Michael, you're going to pull up the PowerPoint for our proposed budget. This is our county operating budget. We'll be working very closely with county management, county budget office, and county finance, along with our normal state estimates that we will get from the state in terms of what our state and federal revenues and projections and funding will be. And so this is an annual event. You should have your booklet with you. In your booklet, if you're following the booklet, or if you're following on screen, if you're following the booklet, there is a pending what we call a transmittal letter. It is the board's responsibility to approve the transmittal of the budget to the county per North Carolina general statute. The board doesn't have any authority to approve funding, but you do have the responsibility to say you've reviewed the budget, you support it, and you authorize the department to transmit, meaning give our proposed budget to the county. Again, it's a proposed budget. It's a long ways from being completed. There's several months of more work that needs to happen. We've gotten instruction from the county budget office, and we'll get further instruction. I've had a preliminary meeting with Dwayne, our deputy county manager, but I'm sure there's going to be much more discussion about the budget and the budget process in the coming months. At the end of the day, our proposal will go to county management. From there, county management will craft their budgets for the county. Then it will go to the county commissioners, and then the county commissioners will then complete the process and and develop a budget for the county for us to move forward. So this is very much at the infancy stage, and there will be more to come. This is our proposed budget, and this is kind of our wish list. And so that transmittal letter, once I've completed the presentation today, if you support and approve this budget, then we will need a formal motion and formal action from the board to then transmit. And then we will take that watermark off of that letter and then get it over to the county. After the letter, you will have several sheets, and this is the same format we've used in the past. Board members, you'll have several sheets that have a bunch of numbers on them around the budget summary. I'm going to do the PowerPoint presentation, and then into the presentation, I'm going to turn it over to Dawn Keeler, who is our finance manager, who's led the efforts to pull all the numbers together, and she'll go over those sheets with you. So I will ask you to direct your attention to the PowerPoint presentation, either in your booklet or that's on the screen as it relates to just sharing with you what we're proposing. So I'll stop there and say, are there any questions before I move into this presentation? Okay, great. So this is this first slide is just really just a overview of how we've outlined the budget. We'll do a high-level overview, and then we will share with you what we see as our budget needs. Again, I'll turn it over to Dawn, and she'll talk to you kind of about the numbers. These are our needs, and this is how much it'll cost. We'll talk about some looming issues, and then just some next steps. So our budget, our goals for this year as it relates to services and the impact of those services in terms of how we pay for them, just lots of things going on. And first and foremost, that we're facing, the most immediate and pressing need, of course, is COVID-19. We've had to completely change the way we operate because of COVID-19 and this pandemic. We have about 75% of the staff working in some form of either total remote work to some type of hybrid where they're coming into the office for a percentage of time and they're working remotely. And then we have a percentage of staff that come to the office every day. So we have a hybrid model, a combination of how staff are coming and reporting to work. We are continue to be closed to the public. However, we are providing all of our services as though the doors was open through remote means, including telephonic, video, and we are still providing services out there in the community, meaning we still have child protective services workers, adult protective services workers, drivers, those type employees who their job function is out there in the community. They're still doing that work using protocols and protective equipment, PPEs, masks, gloves, gowns, those kinds of things in order to do the job. We also recognize some efficiencies. We were fortunate that we were prepared with the technology through staff having laptops. We already had Microsoft Teams that allows us to meet, to talk, to interact with customers virtually. So we were fortunate that we had a lot of our infrastructure pieces in place. Renee talked about our vacancy and turnover rate. What we've realized in this COVID environment, that teleworking is possible. Overall, our productivity has been very good in terms of staff being able to do the work. Our citizens have been very responsive to the new way of doing business, whether they're doing paper applications, dropping them off in the Dropbox, mailing them in, faxing them in, using technology, taking pictures, texting it in, and again, the other virtual methods we talked about have seemed to respond very well to the new way of doing business. So, one of the things that we really need to explore is what does business look like after this COVID environment, and what lessons learned and what opportunities we may be able to realize in this new working environment, especially as we look at recruitment and retention of the new workforce, which are our millennials who like the idea of being able to have some flexibility the way that they do the work and not the traditional 8 to 5. So we certainly want to explore any opportunities. And of course, continue to monitor what's happening with COVID as it relates to will we continue to be working in this particular environment in this particular manner. Of course, we're also working with the public health department around vaccinations, and a lot of that will be contingent upon what that looks like as well. Other goals that we have is, of course, to improve recruitment and retention. We are still having lots of competition with other, within our county, within the city, within other departments as it relates to recruiting and retention, especially social workers and income maintenance workers. We're always looking at efficiencies and how we can do the work in the most efficient, effective manner. So we're always looking where maybe workloads have decreased, how we can shift resources, how we can shift the workforce to cover other areas of our business that may be at a higher demand. So we're constantly looking at how we operate and how can we do that in the most effective and efficient manner. Of course, we are federally mandated, state supervised, and under that state supervision, there's also state mandates, and they're constantly changing. So we're keeping abreast of those trends, including any performance standards that we have to meet based on federal or state regs. Part of those mandates is 100% accuracy rate in Medicaid. And when we don't meet that 100% accuracy rate based on monitoring and audits, that could mean financial penalties and payback. And so we're monitoring that very, very closely. The feds have a 3% error rate threshold where North Carolina has a 0% error rate. And this work is complicated and complex, and there will be human errors. We try not to make human errors, but we are not perfect. And so we're monitoring that very closely and the fiscal impact that that could have on the county. And of course, we're always looking at how we can increase permanency and well-being for children in foster care. Our numbers look much better than they have in the last 10 years. We have traditionally had the highest number of kids in foster care, with averaging somewhere around 900 to 950 kids. And at times, some board members, you may remember, we've been close to 1,000 kids in care. And if you looked at the numbers that Renee just talked about in the production report, you will see that our numbers are under 800. And we're really excited about that, and that's to be celebrated, but there's still lots of work to do on that front. And so, of course, want to continue those efforts. There's also federal and state reform efforts to child welfare that's going to change how we do child protective services, Rollins Law and Family First Prevention Act. That's major reform efforts based on how we use federal funding to pay for these services is going to change, but also with a heavy focus on prevention, which is great. The system child welfare system has predominantly been set up on our being reactive. A child has been abused or neglected, and we're reacting to that abuse. The focus of a lot of this legislation now is really around how do we try to prevent it so we're not reactionary. We're not having the first reaction is to take kids into custody, but how can we work better with families so that kids can remain in their homes, in their communities, but at the same time protect their safety and well-being. And so those are kind of our goals and our focus as we, that's a broad brush of it, of our goals as we prepared this budget proposal. So our next slide is really what are we asking for? What do we see as our needs? And so we outline those in the next slide. So we are proposing that we ask for 4 new child protective services, social workers. And you said, well, Brenda, you just said your foster care numbers went down. Why are you asking for 4 new child protective services, social workers? Our foster care numbers have gone down, but our cases are so much more complex. We also anticipate with COVID and school being out that there may be children at risk. We know that the schools are often our frontline eyes and ears to the protection of children. Most of our reports, the large majority of our reports of child abuse and child neglect are from the school system. And with schools being out now close to a year, if you count the end of last year's school and the current school year, almost a year, we expect that those numbers will probably rise. But when you look at the complexity of the cases, the opioid epidemic, the rise in domestic violence, the complex and chronic mental health needs, and we exceed the state standard for foster care, for investigations, and for case management services. Those social workers are carrying high caseloads, and you add to that the recruitment and retention efforts that we struggle with social workers. And so we'll be asking for 4 new child protective social workers to address those issues. Our supplemental requests are those things that we're asking to enhance, or there are capital improvement or our main care item. We're asking to reclass 15 current positions. As I stated around our goals, one thing around our goals is that we try to look at effectiveness and efficiency and how we can, again, shift resources around to meet needs. And so our Work First employment program has drastically decreased, and that's a good thing. Work First is our, it used to be the old welfare program, but it's an employment program now. And this really is how we help individuals to maintain self-sufficiency and those folks that need help with soft skills. And we're glad that less people need that monthly cash benefit. And so we've had social workers that support that work, and we will be shifting and asking to reclassify those social workers because those numbers have drastically dropped to address areas such as adult protective services and guardianship cases where we're seeing high numbers. Adult protective services and guardianship numbers are high because if you'll recall, when the state divested of the county mental health system and went to a managed care system, we were given all of those mental health cases. We gained initially 5 or 6 years ago about 86 guardianship cases, and those numbers have continued to grow. What's different with those cases than our regular guardianship cases, which have been our aged and elderly guardianship cases prior to the divestiture of the mental health system, those cases, folks are aged and they're elderly, and they tend to, unfortunately, have, I'm trying to be careful about my wording here because we're broadcasting live and I certainly don't want to sound morbid here, but just those, the length of life expectancy is shorter in our aging and elderly population, but our mental health population, so let me back up. So if we get an elderly and aged person at 70 or 80 years old, their life expectancy at that point is shorter. However, with our mental health cases, we may get an 18 or a 19-year-old, and their life expectancy may be another 50 to 70 years. So we keep those cases longer. And so you don't have the natural attrition of the caseload with mental health. And so that has been a challenge, and those numbers continue to grow. The other area that we are having a need for resources is across the board in income maintenance. We've always struggled with adult Medicaid. If you look at data around the graying of North Carolina, the graying of America, the graying and the aging of the baby boomer population, you see a growth in our aging and adult population. And so therefore you see an increase in our adult Medicaid. Seniors that need help with their medical bills, with long-term care, with nursing care, assisted living. But with COVID-19, what we're also seeing is an increase in need for food assistance around food and nutritional services, better known as food stamps, but also just regular Medicaid for family and children because of medical bills related to COVID or medications, or even the after effects, the long-term after effects of needing medical care once the person have moved past their initial crisis or diagnosis of COVID-19. So maybe they're in the hospital, maybe they're in intensive care, but then when they go home to rehab or for their recovery, they still have medical needs. And so we're seeing, because of COVID, increased numbers in our eligibility programs. And so we want to try to reclass some positions to meet those needs. The other issue that we are seeing is pay equity issues, and that happens really based on how the starting range of a salary is versus how raises are given, whether they're, COLA raises or different things like that. So, this system is really based on longevity, and it's based on when you come in, where you are, where you start out on the pay range. And so we've seen some pay equity issues, especially around our personnel tech and our clerical support staff. The other issue that we're seeing around pay equity and the ability to compete. We've lost some great staff to what we call county enterprise. For example, we have a small HR team here, but when they go to the county, that is more of an enterprise. So where they are providing services just to DSS and our HR, when they go to work for the county, they may be working HR through all of departments, health department, engineering, veteran services. And so they get a wide range of experience, and that scope is wider. So those classifications are higher, therefore they get paid more. So we've lost staff to what we call county enterprise, to the city, and we're struggling to compete, especially with counties like Harnett, Johnston, and Sampson County. Sampson County has about cleaned us out in social workers. Johnston County has taken a lot of, in Harnett County, we have a lot of folks moving to those two counties because they pay more. And so how do we compete? And so looking at pay equity issues, especially in our HR, in finance, accounting, and our clerical support positions. And so those 15 reclasses that we're requesting are related to workload demands, increased caseloads related to COVID, pay equity issues, and competition. And I did leave out, I would add quality assurance, because as I shared with you earlier, Medicaid now at the state level has a 0% error rate. So we need to be watching and monitoring and quality assuring those cases to try to prevent any type of payback that would be the responsibility of the county to cover. So I'm going to pause there and go to the next slide. Okay. The other thing that we're asking for in our supplemental budget is improved access to human services. And it may seem simple that we're asking for a golf cart, but and while we're closed to the public, we certainly believe that COVID's not going to be here forever, and we will be back to some level of regular operations. And one of the challenges that we have is, especially with our public health department, is it looks like a short distance when I look out my window and I can see the public health department. However, it's a long walk, and it's a walk that you have traffic. We have a lot of through traffic here on the campus. Both of these departments are fairly large and have a large customer volume and employees that are driving through the parking lot, and there's no direct sidewalk between DSS and public health. And so we'd love to have a golf cart to just better provide customer service to and from these two departments. Technology enhancements, we have just a numerous technology enhancements around backup systems. We have annual renewal costs for a system called Barracuda that is a major backup system for some of our internal operations. There's also some new county policy around the use of cell phones. We have a lot of staff that use their personal cell phones, and because of just confidentiality, protection, keeping folks from being hacked, making sure we got proper safeguards on phones, that is critical that we use county issued phones that will be equipped with those types of precautions. And so all of that costs money. And so our technology budget pretty much encompassed those things I just described. The big we're asking for is we're very pleased that we had probably 95% of the building had carpet replacement, but there were several areas, the care center, break rooms, and the first floor conference rooms did not have their carpet replaced. So we're asking for that process to be completed. And then the renovation of conference rooms A through D, and everybody's familiar with those conference rooms. We call them the first floor conference rooms. It's 4 rooms. They can be opened up to one big room that 700 people, or they can be divided into 2. They're often used by community stakeholders. Of course, we use them here at the department. The county uses them. The city uses them. And those rooms have had a lot of tear. The carpet looks horrible, because folks are allowed to serve food and different things in them, and just, almost 20 years of wear and tear on those facilities. The tables are heavy. They're difficult to dismantle. The chairs are worn. We have 2 different types of chairs. They're worn. They're starting to fall apart. The technology in those rooms have not kept up with the times, and we're certainly realizing that with COVID. And so the AV equipment, the cameras, Wi-Fi, all of that needs to be upgraded. And so we're asking the county to consider upgrading a complete overhaul and renovation of conference rooms A through D, so that we can continue to meet the needs that we have for the use of those rooms. But also those rooms really act as a conference center for the county and for other community stakeholders who are eligible to use it. I would make a note around our customary inflationary costs. It's a little of an anomaly this year as it relates to, we always allow for any type of inflationary costs around travel. Gas prices go up, travel reimbursement goes up, fringe benefits, any increases in health insurance costs and those kinds of things. And because we've operated, some of those projections are just a little skewed right now. But we did make a note that it's hard to project what that might look like, because this has not been a normal year. But we know that customarily we do have those inflationary costs. With that said, I'm going to stop here while we advance to the next slide, and Jen, Dawn up to go over. I'm sorry, I was out of order with my slide here. I got looming budget issues. I changed it around a little bit. I was trying to do it from memory. Let me stop there and see if there's any questions from board members. That was a lot of information I just shared. And then we'll get into the looming issues. Any questions from the board from what I've gone over so far? I usually have that looming issues after the number slide. So I changed it up a little bit. All right, so we're going to the looming issues, budget issues. And these are things that, we know are coming down the pipe that we really don't have a good grasp on what the fiscal impact is. Some of it is kind of more of decisions we might need to make, or things we just need to be on the lookout for. And I've talked extensively about the COVID pandemic. We just don't know at this point how that will impact moving forward. We certainly believe that we at some point will be back to some sense of normalcy, but what that looks like and what that means. And of course, the lessons that we've learned are opportunities that we may be able to realize. And so it's definitely not all bad. There are definitely some opportunities. We continue to be concerned about the lack of crisis residential mental health services for both our children and for our adults and board members. I do appreciate your continued support and advocacy on this effort. And we have been working extensively with Alliance Health. I want to thank Dwayne and Commissioner Adams for they're also Alliance board members, but they've been strong advocates around this issue. And I'm pleased to say that we are seeing progress. We had a meeting last week with Alliance, the hospital, juvenile justice, and the court system, and state mental health. And they have heard our concerns. They've listened to the issues, and they have responded. And so we're working with them on possibly having a crisis group home here in Cumberland County. They're working on a protocol to address issues so that we're not having to spend the night at the office or have youth inappropriately placed in our level 1 group home. They are feverishly working on a regional crisis center to serve the catchment area that will be in Harnett County. So in the coming months, when I say coming months, between now and probably sometime in July, I think we're going to see some real progress, but we need to still stay on top of it. You did ask board members to have Alliance Health and state mental health to come to your February board meeting, and they have confirmed that they will be here to share in more details with you about what they're working on. But we're in a better place. Not completely out of the woods, but we're certainly in a better place in seeing some significant progress in this area. I just talked about the continuing growing of foster care and guardianship population. That's especially true with new legislation around raise the age of kids in foster care and to raise the age of delinquency kids. But we've also done some really good work through our AMAC project and working very closely with our court collaborative and working closely with DJJ and starting to see some of those numbers decrease. And so that a lot of work is happening there too, but we still need to continue to monitor and that very closely. And I've already talked about the adult guardianship cases that were transferred to DSS and that impact. So on the next slide, Medicaid transformation. I was in meetings last week about Medicaid transformation. As you know, it's moving to a managed care model. It is supposed to July 1, 2021. Won't impact us a whole lot. It will not change the way we determine eligibility for Medicaid. It will change the way in which customers receive their health benefits once they are approved for Medicaid, where they will have to choose one of 5 healthcare providers that will manage their health, any mental health, transportation, all of those programs. As you know, we're also a transportation provider, and we've met with the contracted healthcare providers under Medicaid transformation, and don't feel that at this time that this will be feasible for us to continue with providing non-emergency medical transportation and to be a provider under the managed care system. Those healthcare providers are mandated to provide these services to our citizens, so citizens won't lose services. But because of the rates, because of the way we would even try to get the reimbursement, we don't see DSS continuing in that role of being a direct provider, meaning not only are we determining the eligibility, but we have vans that are going out to transport individuals that receive Medicaid. Medicaid transformation is a transition process, and so not all Medicaid recipients will initially fall under the plan. So we will continue to provide direct transportation services for what they call FIFA services for those Medicaid programs that don't yet fall under Medicaid transformation. And we believe through attrition, we've had some vacancies that we haven't filled and we've looked at the numbers of citizens that won't fall under Medicaid transformation, that we will still provide that services to, that we feel that we have sufficient staff to do that and to meet that need. But we'll continue to monitor Medicaid transformation as it rolls out between now and July 1st, and then any after effects of the rollout. Implementation of NCFAS Phase 4 child welfare, that mainly is based on Rollins Law, but it also has the rollout of what the automated technology system that will be used to address the operational piece in terms of records, how staff document, how they do their work on paper through the NCFAS system. And as you know, we've had major issues with NCFAS when it rolled out in our eligibility program. There's been a lot of work and focus on ensuring that that system does not create any difficulties as it relates to doing the work. Specifically around, is it a user-friendly system? Is it a system that the social workers can easily navigate? They can easily find their records. They can easily upload their work into the system. They can easily do their documentation. They can easily assign cases and transfer cases. And so it really is a technology system, a technology operating system that we have been working very closely with the state to make sure that it's user-friendly. Will it interface with our existing systems like our document imaging system? We use Laserfish. So can we pull the information from our existing systems into this new system, like birth certificates and records and those kinds of things? And so that system is going to roll out, and we're certainly hoping that a lot of the work that we've done and given the state feedback on when they rolled out NCFAS in our eligibility programs, that there have been lessons learned and that this will be a more user-friendly system. And I talked about earlier, we have federal laws and state laws coming down the pipe. We have the Federal Family First Prevention Act that really is going to, again, focus on prevention. And it is going to change the way that we use federal dollars that pays for the administration of our child welfare program, meaning it pays for the social work salaries, it pays for operations of our child welfare system. That's going to be coming down the pipe, and I don't have a whole lot of information on that and what it will mean for even our federal reimbursement. Those dollars cover about 67% of the cost of a social worker, and what that might look like and what that formula will look like, or change or not change. Also, the Federal Family First Prevention Act also limits the amount of time youth can stay in congregate care. And while our numbers look better, we still have a large percentage of our 13 and older kids, our teenagers, that are in congregate care, meaning they're in group homes, large group homes. And so it limits the amount of time kids can stay in that care, in those care. And now kids average a year to 2 years in those types of settings. So it is really going to make us and force us to focus on how do we serve our teens in a very different way and have them in more family-like settings, connected to forever adults that can mentor, coach, and shepherd them through their life. And so it's going to really change the way we do business. And then Rollins Law. Rollins Law is around regionalizing state support for county DSSs, and we'll see a lot, and we're already starting to see some of the reorganization to provide more support to counties, the state providing more support to counties. It also incorporated performance standards that we have to meet across all of the program areas. And I've provided a lot of information to you board members and work closely with county management to establish what those standards are and to track where we are. Overall, we look really good around all of our performance standards and all of our programs. Both of those legislation still has lots and lots of components to it that will be rolling out in the next year. Family First prevention will start rolling out October 1, 2021. And we're already rolling out components of the Rylands Law. And that should fully roll out by 2022, that particular piece of legislation. Both of these are large, comprehensive child welfare reform efforts. And what I've shared with you is just a tip of what these are about, but we've been talking about them for some time now. And so those are some of our looming issues. Next slide. All right, so now we're at the point. So I'll pause there as this time Jen Dawn to talk about the numbers. We can go to the next slide. Board members, I will stop and see if you have any questions on what's been covered so far. All right, with none being said, Dawn, you want to, board members, you want to take it? And board members, Dawn will be going, if you go to the front of your booklet, past the letter that I talked about, I talked about those documents that have the combined budget summaries on them. And I don't think we have those on the screen. Those are, and Dawn's going to be going through those numbers in a little bit more detail. And then we'll wrap it up with this summary page that's here on the screen. So Dawn, I will hand it over to you. And what Dawn is basically going to do, board members, is now tell you all the things I just shared with you, all of the needs, all of the things that we're asking for. Now she's going to tell you the numbers that go with those requests.
Hello, my name is Dawn Keeler. I'm the finance officer. How are you today? So on this proposed budget sheet that's on the PowerPoint, it relates back to those forms, but the top one where it says total operating budget, that is our target budgets. Our target budget is our budget that we have that we do all of our normal operating expenses out of, okay? This budget is, if we think, so if you look at the target budget summary, this breaks it down. We have 4 organizations. Our target is actually $925,000 less county dollars than it was last year because we had that stipend for the employees last year. We will not have to pay this year. And like Brenda said earlier, we don't want to make any major changes because we don't know how the projections are going to look, what's going to happen when people come back to work. So our target budget is this $63,769,155. Okay, our total supplemental request is $407,200, and that relates to the sheet that says supplemental budget, and it breaks down all of those requests that Brenda relayed earlier, and what is the actual cost, what is the reimbursement, and what is the county cost. So our total cost for those requests that she detailed earlier is $407,200, with an additional county cost of $211,720. Okay, can't ask for positions because positions are not 100% reimbursed. So part of it is reimbursed, part of it's county costs. So the supplemental sheet at the beginning of your sheet details each one of the total costs, what the reimbursement was, and then what the county portion of it is. So our total requested budget is $64,176,355. This shows that our county adopted budget for 2021 was $23,912,203. This year, our county request for fiscal year 22 is $22,986,733. That's a decrease in cost of $714,106. That takes our, if you look at the combined sheet from the beginning of the page, it takes our decrease in the target budget plus the increase in the supplement in the cost. Okay, scroll, if you can scroll down on that sheet. And our total budget, Michael, who's scrolling on the sheet? You scroll down on that, just can you make that page a little bit smaller? At the bottom of that, there's some things.
Dawn, I think, this is Brenda, I think we're able to see it on the screen. You may not be able to see it in your screen.
Okay. Well, I can't see
We
it.
can see
So we-
the slide.
yeah, maybe I can make it smaller. There we go. Sorry about that. Okay, so our total budget, including program expenditures, is $715,901,248. The big difference in that includes all the public assistance programs where citizens in Cumberland County receive services. So that includes all the food stamps that our customers get on their EBT cards, and all the Medicaid, and all of the Work First and the adoption assistance cash, all those cash assistance subsidy payments that our citizens receive through us, that's included in there. But our operating budget is $64 million. Okay. Our total budget, proposed budget, including target and supplemental, it's a net decrease of $714,000. This includes what our allocations were for this year. Okay. Our budget estimates for fiscal year 22 don't come out until February 15th. And as Brenda said earlier, we will be making changes to this. As soon as the budget estimates come out, they will be put into our spreadsheets so we can update and get the most up-to-date information for fiscal year 22. Does anybody have any questions concerning any of the individual sheets or any of the overall information that I've presented?
Well, Dawn, I guess you've covered it pretty good. Nobody seems to have any questions.
Thank you.
So the next sheet really goes into kind of what the next steps is. Again, we're very much at the infancy stage of the process. And so one of the things, in order for us to forward to the next level, which is giving it to county management, is we would need the board to take a formal action. If you approve of this proposed budget, you're not approving the budget, but you're approving that what we propose to you, you can support, and we can transmit it electronically to county management. And then, of course, we're going to monitor what's happening with COVID, what's happening in Congress, what's happening at the state legislative that may have potential impact. As Dawn said, we won't get the state budget estimates, but to give us a good idea where we are with receiving our federal state funds. That doesn't come out until February the 15th. We will, of course, once we transmit the budget to county management, they will go through it, vet it. They will have lots of questions. Usually Dwayne and I meet. We also have the departmental meeting with county budget folks, and it'll go through a process. And then the county manager from there, once she gets all the department's budgets, will pull together her budget that then will go to the commissioners, and then the commissioners will go through their budget process to have a final budget sometime in the coming months. And so, as Dawn said, they may be continued budget amendments based on those processes, and we'll work closely with everyone on that. And then, of course, our acknowledgments. The next slide is really thanking everybody. I'm just the face. I'm just the deliverer. We go through a rigorous process that we start in September with the management team, and they are able to work with their individual sections to determine what their needs are, and they present to me their budget goals, budget needs, and then we vet that through the management team, and then we work with our HR staff, our finance staff, and Dawn has a dynamic team. I would just be remiss if I didn't acknowledge her finance supervisors and her budget staff, and the whole finance team for the great work that they do in pulling these numbers together and working closely with county budget and county finance. And so there's a lot of people, our facilities people pull numbers together for us for all of the repair of equipment, capital improvement plans. But there's a lot of people behind pulling together this budget. I just happen to be, I have the easy job of being the face of it. And I just want to just say a great job to everyone, Angela, Maritza, Natasha, everybody that pulled the packets together and pulled the booklets together. But it's an awful lot of work, and this is work that it used to be, we used to have a quiet summer and there used to be a lull, but now we kind of work on budget 12 months out of the year. But it's been a lot of intensive work since October to present to you this proposed budget today. So just great job, everybody, and want to acknowledge for all those people that helped to make it happen.
And Brenda, I just want to echo everything you said with regards to your staff, and also we were all smart enough to know that this wouldn't have come together without you. And at this time, if there's no further discussion, I'll entertain a motion to approve transmittal of the proposed budget.
I make a motion that we approve transmittal of the approved proposed budget.
Is there a second?
Second.
It's been moved and seconded that the board approve transmittal of the proposed budget. All in favor, say aye.
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 Motion is approved.
Great, thank you.
Moving on to the director's report. Right back to you, Brenda.
Thank you. And Dwayne, I'm sorry, I didn't know if you had any comments that you wanted to add. I know in terms of the county process, I meant to acknowledge you, and if there was anything that you wanted to add or make any comments about as it relates to the budget, Dwayne. I apologize.
No, I think you covered it well. I just have to, put my disclaimer out there that obviously we have a heavy lift, a lot of unknowns as it relates to the local economy and the impacts of COVID on our anticipated revenues. But we definitely want all of the departments to include what they need. And because if we don't know what the needs are, we can't consider. So even if things are not approved, that's not a sign from management that we don't think they're legitimate requests, but it's all about priorities, and we do the best we can with what we have. But DSS has always done a very good job of giving us a level of detail that helps our decision-making process. So we're very appreciative of that.
Okay. Well, we know you've got our back, Dwayne.
Yeah, and I tell you, we have a great process, and we have county management that I'm in awe of their knowledge of our department and of our needs, and we try to submit what we think is fair and reasonable and not exorbitant, but we also certainly understand DSS is just one of many departments that have many needs, that serve our citizens that have many needs. And so we certainly stand ready to work with the county and as it relates to this budget process and trying to meet the needs, not just for DSS, but throughout all of county government. So thank you. Board members, in your packet, in the director's report, you have a copy of your association's newsletter. You are members of the North Carolina Association of County Boards of Social Services, and you're members as a body. And wanted to share with you your newsletter. They always send it to us to ask us to send it to the board members. It's a very, very good newsletter. I have the pleasure of working very closely with your association because I chair the advocacy committee for the DSS Directors Association, and we work closely with the Boards Association on legislative matters. So I work really closely with Betsy Wells, the president of the Boards Association, and she's very passionate about this work. And so it's a really good article with really good information. Some of you may be familiar with some of the information in there, especially the information about the former retired director of Cumberland County, Bill Scarlett. When Bill retired, he became a board member in Vance County, where he relocated to, and he's been a very active member of the Boards Association, has lent his knowledge and expertise to their work. And there's a great tribute to him in there. And hopefully you get a chance to, if you haven't already, read that. They got a lot of good information in there about healthcare coverage, about COVID. Their quarterly meeting was in January, and I was involved somewhat with that, some legislative items that they were talking about there. They also outline your regional rep, and we have a new regional rep. You have a new regional rep. Her name is White. She's the board member of Vance County, and so any information that you have, you can give Gloria a call, or anytime you want Gloria to come, we can invite Gloria to come to one of your board members to talk about the work of your association. And I know that several of you have been to the Institute, the annual conference we have with social services. That's a joint endeavor with the Boards Association. So I know many of the members and have been involved yourself with the work. And so just want to make sure you had that information and wanted to just kind of highlight a few things there. Just real quickly under general information, just wanted to touch bases on a few things. We go into closed session, working very closely with our dynamic public health director. Let me tell you, I couldn't fathom becoming a new director in a new community, a new county, a new city, and then having to be the face of all the work that has been required in dealing with the COVID pandemic. And we got the best health director in the world. Dr. Jennifer Green is just awesome, and she has just been a pleasure to work with. And we try to support her department as well as she supports us, and it's been a good partnership. Public health is working diligently with their staff, and we're supporting the effort along with library, county emergency services, and every county department trying to support the effort of COVID, but especially around the vaccinations. And hopefully those of you that qualify 65 and older, that you have, if you so desire, to get a vaccination, that you've been able to access the wonderful drive-in services that they've had at the Crown Center. And so we are working closely with public health as it relates to where social services employees fall at one time they were priorities, now they're groups. Where we fall in the groups, we have been deemed in two different categories as it relates to where we fall as essential employees. Under the governor's executive order, all of DSS is deemed essential. Under the secretary's authority and directive, adult protective services and child protective services are considered first responders. So right now, services adult protective services and child protective services in group 3. And as you know, they're in group 2 now. Group 1 was healthcare workers, healthcare providers. Group 2 are 65 and older. And so the adult protective services, child protective services staff are in group 3, and then the other are in group 4. And so we, management team have worked closely to pull together a mechanism to work with the county to have those staff at the time when vaccinations are available and those groups start receiving them, to upload our staff that want vaccinations. It's not mandatory, that want vaccinations, to start working with public health to set up appointments to get those individuals. Again, once the vaccination is available and once those groups are activated to receive them. And so again, working very closely with our public health director, and we're continuing to help with contact tracing, I call her about every other day to check on her to see if she needs any help with vaccinations and however we can support them in this work, and we'll continue to do that. What's coming down the pipe, I'm not quite sure in the new legislation or COVID relief packages that's been discussed. One of the things that we know is going to happen is that they've expanded the pandemic EBT, what they call the PEBT, food and nutrition or food stamp benefits. Getting information about this anytime now about how that's going to roll out. What we do know is any child or school that now qualifies for free and reduced lunch dating back to August 2020, that they will receive retro pandemic EBT benefits. So let me give you how that works. So if there's a percentage of a school that has a high percentage of free and reduced lunch, every child in that school could qualify for pandemic. Because so many families were impacted by COVID, when they did the PEBT back this summer, some of the schools did not, the whole entire school didn't qualify. However, because we've seen an increased number and increased need of individuals who may no longer be employed or they have reduced hours, more children have qualified for free and reduced lunch. Meaning then that a school that maybe didn't qualify this summer, because more kids in the last 6 months qualify because of the conditions in COVID, that school now may meet that percentage threshold, and therefore every child in that school may now be eligible. And if that's the case, when they go back and look at those numbers and they rerun the numbers of the schools, they will then, they being the state and feds, will then give every child in that school that didn't receive free and reduced lunch and pandemic at that time, but do now, will get it. So that will go back to August 2020. So there's going to be a retro benefits for schools and children, schools that now meet that percentage threshold, and children that did not receive and were not eligible back last summer, but their conditions have changed and they're now eligible. They will get retro benefits. Moving forward, starting January 1, so that's August to December 31st of 2020. Those are the retro pandemic EBT benefits that will be issued. Then effective January 1, moving forward right now until school is projected to end in June, or if school doesn't return back after the summer because of COVID on a full-time basis, could be expanded past June until the next school year. Every child who's eligible for free and reduced lunch in every school that meets that threshold, the children in those schools will all get pandemic EBT starting January right now through June. But if schools are still on limited operation due to COVID after June, it can be expanded past June, and they'll get those benefits every month. It's estimated that each child will get around $300 per month in pandemic EBT benefits. I say all that to say that there's going to be a lot of issuance of food assistance. And we're expecting the letter to come out from the state anytime. They've been working on it. They've been meeting with the directors, letting us know that it's coming down the pipe. I know they're going to be working with the Grocers Association to try to stagger that, not to cause a greater food desert or food shortage. Grocers Association says that they can meet the demand, and so there will be a lot of resources out there for food assistance. So that's coming down the pipe, and I'll get that information out to you as soon as I get it. I know it's complicated, but It's retro benefits and ongoing pandemic EBT benefits that will be coming down the pipe. I shared with you as part of the budget presentation some of the work we've been doing with Alliance and state mental health that's looking very well. And again, that will be attending Alliance Health, and the state mental health director will be at the February board meeting. Dwayne usually attends as an Alliance board member, and Dwayne, I do plan to let Commissioner Adams know, who's also an Alliance board member, that they will be here talking to the board, and certainly invite him to be part of that meeting. And I think, board, you had asked me to do that as well. I don't want to overstep here, board members. You did ask me to do that.
Brenda, you might want to also reach out. We have a third Cumberland County member on Alliance's board, Miss Lodi's Gloston.
Okay.
And if you need her information, I can get it, but I think it would be good for her to attend as well.
Okay, if you can send that to me, Dwayne, that would be great. And what I do is I'll send one email to the three of you as board members.
Okay, thank you.
I will do.
And I apologize, I have to sign off for another meeting.
Well, thank you for being here, Dwayne.
Okay, thank you. Thanks, everyone.
Hey, Dwayne.
Board members, we're also, I did send you some information about the Court of Appeals case that was in the media. I'll talk more about that in closed session as it relates to the details of the case. But we foresee that we may be asking the state Supreme Court to take on that case, and I'll have more details because it's case-specific information that I can share in closed session. We suspended supervised court-ordered visitations for foster kids right after the Christmas holiday to make sure foster kids got a chance to see the ones that have court-ordered visitations with their parents or their caregivers that have been assigned to have those visits. We decided to suspend the visits because the COVID numbers were really going in a bad direction. I did consult with our public health director, and she certainly recommended that we cease those visits just to reduce the exposure. Also, once the visits were suspended, the secretary issued through the governor a staunch directive to limit contact with just those that live in the home. And so been working with Judge King, our chief district court judge, around that issue. We are required to file motions when we're going to suspend visits, and been working with them and our legal team in terms of what that might look like. We don't have to file motion if these cases are going before the court during the suspension period. And we will be, matter of fact, looking at the reports from the Secretary's Office and Public Health over the next few days to determine whether or not we can lift the suspension, if it's safe, or if we need to extend the suspension of visitation. This is where we have social workers and staff that are transporting kids, sitting in the room with kids and parents to do supervised visits. We are offering an alternative, which is to do those visits virtually. We know it's not the same as a parent being able to hug their child or anything like that. We are doing virtual, we're doing telephonic, but just because of the safety issues, parents are not tested prior to these visits. Kids are known to be carriers. Social workers are having to be close contact with both, having to transport kids and sometimes parents in their personal vehicles, and it just puts them at a higher risk of exposure. So for safety of the children and the staff that serve them, we felt that with the numbers being high and spiking in the way that they were after Christmas and really right up until a few days ago, that it was in the best interest to do that. And again, did that in consultation with the public health director. We will resume those visits as soon as we can. If you remember when COVID first hit back in the spring, we suspended visits for almost 3 months. We certainly are hoping to get visits back up as soon as possible. And then finally, I sent you an announcement. We have selected an assistant director for legal services. His name is Patrick Kuchit, and Patrick is already on staff as a staff attorney. We had the former assistant director, Bobby Redding, who's graciously stepped up as came out of retirement to help us on a part-time basis. We had retired assistant county attorney Phyllis Jones, current assistant county attorney Chris Carr, management team. All of us participated in the interview process. We did not have a large application pool, but we had a good, small but good. And we think Patrick's going to do a great job. He's well respected by the judges and the court, well respected by the staff. He has a great demeanor, and he'll do a great job. Very smart. He's a U.S. Air Force veteran, and understands the military community that we're serving in. And so I think he will do a great job, and we're very excited to have Patrick on board. And we'll make sure starting next month, he will be here along with Bobby and to introduce him. And we'll be participating. And Bobby has graciously agreed to stay on board to help mentor and transition Patrick through this process. And so thank you, Bobby, and we're excited to have Patrick. We did a rigorous assessment center for the assistant director for children's services. Thank you, Bill, for participating in that process. We had county management and about 13 or 14 community partners, everybody from the Fort Bragg Child Advocacy Center, Susie Reeder, former board member, but also an adoptive parent. We had law enforcement, the school system, child support. We had program managers on staff be involved with that interview process. I have a recommendation. We're in the process now of doing background checks and drug testing, and I'm hoping to make that announcement in the next week or so on that candidate. I think we have a very good candidate, and we can talk in detail in closed session about that, because that's a personnel matter. But I do hope to make a decision and make that recommendation known in the next week or so. With that said, I think that's all I had for just general information.
Okay, thank you, Brenda. Nobody else has any questions. I will conclude the regular business. Thank everybody who participated or attended. And I'll take a motion to move into closed session.
I make a motion, we move into closed session.
Second.
It's been moved and seconded that we move into closed session. All in favor, say